Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. In 2 days from now, that is on January 16, India will start what will be perhaps the world's biggest vaccination drive against COVID 19, which so far has killed more than 150,000 people in the country. For this drive, two vaccines have been approved by India's drug regulator. One is the Oxford AstraZeneca vaccine called Covishield, which is being manufactured by the Serum Institute of India. And the second vaccine is called Covaxin by Bharat Biotech and ICMR. Now, there have been many concerns raised about these vaccines, especially Bharat Biotech, which has been approved even though its efficacy data is still pending. In this episode, we will talk to one of India's top virologists, Dr. Shahid Jameel, about what exactly these concerns are, what does efficacy data tell us about a vaccine, and how do these two vaccines compare with each other. But before we do that, let's look at the logistics and the challenges that will be involved in this massive vaccination drive. For this, we talk to Kaunain Sheriff, who reports on health for the Indian Express. And we start by asking him about who all will be part of this vaccination drive.
Since we have very limited doses, we have 1.1 crore doses from the Serum Institute and 55 lakh doses from Bharat Biotech in the initial phases. So it will be sequential administration of the vaccine. So in the first phase, you will have only the doctors, the nursing staff will be administered the vaccines, which are the healthcare workers, the frontline healthcare workers. In the second phase, you will have the other frontline workers who are from your municipal corporations, your ASHA workers, your army personnel. You will have the border security force officials. You will also have the revenue officials who are doing the door-to-door surveillance. A lot of that category will be covered. The third category, which is 50 and above, and the comorbid population, which is 50 and below and with associated comorbidities, they will be administered the third. But in the initial first, these 1.5 crore doses, it will be the doctors and the frontline workers. So it will be limited to them.
This initial group that Kaunain talks about is made up of approximately 3 crore healthcare and frontline workers, while the total priority group has 27 crore people. Now, since there are going to be two vaccines that will be used in this drive, the question is, can different states choose which vaccine they get from the center? Kaunain says that the government has made it clear that they cannot do that, and that this is similar to protocols that are in place in the US and the UK, where multiple vaccines have also been used.
Of course, at the individual level, if the volunteer, which is the doctor, says that he doesn't want to get administered with the Bharat Biotech vaccine because it's just based on the safety and the immunogenicity data, he can say that I don't want to get myself vaccinated. However, the states will not have a choice to choose between the two.
It is also important to note that since those getting the vaccine are just volunteering for it, they can choose to not take either of the vaccines and opt out of the program. And Kaunain also points out that these vaccines will be distributed based on their availability as well.
We know that 1 crore doses are from Serum Institute and 55 lakh are from Bharat Biotech. So there itself, you know that it's not proportionate. We have more doses of SI. So those doses will be distributed first and then the Bharat Biotech doses will be given to the states. So we need to understand that it will be purely dependent on the number of cases each states have. So states like Maharashtra and Kerala, which have higher number of cases, where the doctors are more vulnerable to get the disease, who are actually working on the front line, will be getting a proportionally higher number of doses. So that's how the distribution will happen in the initial phase.
The other thing to note is that people in this initial phase will not have to pay for the vaccine. In fact, only the center will bear the cost of the vaccines and the distribution, and not the states, even though health is a state subject.
So it is very clear that the procurement as well as distribution, everything will be taken care by the central government. However, when you will start vaccinating the third priority group, which is a large priority group, that is 27 crore, 50 years and above, and those associated with comorbidities, that still the government has not said whether what will the ratio of the center and state, how will they divide the financial burden between them, what will be the cost. The larger priority population, which is the 27 crore, we still don't know how that is going to happen, but there's a clear message yesterday given by the prime minister that the first 3 crore the central government will bear the cost of the vaccine.
Both Serum, which is manufacturing the Oxford vaccine in India, and Bharat Biotech recently revealed the prices that the government will have to pay them. Serum will charge the government a special price of 200 rupees per dose for the first 1.1 crore doses. And when we talk about Bharat Biotech, it is providing 38.5 lakh doses to the government at 295 rupees per dose. But it is also giving 6.5 lakh doses free. So for the government, the cost comes down to about 206 rupees per dose. Both these vaccines are to be taken in 2 doses, 4 weeks apart. So the Serum vaccine will cost the government a total of 400 rupees per vaccination right now, and Bharat Biotech around 418 rupees.
So, just to put it in perspective, the price of a single dose of the Pfizer vaccine, which has got emergency use authorization in many countries, including the US and UK, the cost of a single dose is around 1,400. Here, we're not including the overhead cost and the taxes because the information is not available in the public domain. Similarly, the cost of single dose vaccine of the US based Moderna vaccine is in the range of 2,300 to 2,700 based on the countries where they are distributing. The Chinese vaccines developed by Sinopharm cost as high as 5,600 per dose, and the Sinovac Biotech, which is also a Chinese-based firm, the cost of the per dose is 1,000 rupees. And the Johnson and Johnson vaccine, which is a single-dose vaccine, which is yet to get an approval, also costs 734 rupees per dose. So even if you compare the cost to the Johnson and Johnson vaccine, which is a single dose vaccine, the cost of Indian vaccine, both the doses put together, will cost you somewhere around 650 to 660 rupees for 2 doses. So the cost that the government has negotiated is very, very low compared to the vaccines that are being manufactured and distributed abroad.
The vaccination drive is going to be a massive exercise. The initial phase, which will look at vaccinating 3 crore people, is more than the population of a lot of countries around the world that will be looking to vaccinate soon. But even apart from the sheer number, the challenge will also be the places where these vaccines will have to reach and how they're going to be monitored in real time.
You have to vaccinate from people from the valley, you have to vaccinate people in the northeast, you have to vaccinate. So that will be the second challenge. So yesterday, that specific thing that the prime minister highlighted is that states have to ensure real time entering of the data on the IT platform, the Kaunain platform. It is important because you will know how many vaccines are being administered, whether a vaccine is getting wasted, whether they're following the required temperatures from the vaccine store to the vaccination center. That is the thing. And the fourth important or the most important thing is adverse event tracking, that every time something happens, you have to report it real time. Several states in the last few weeks, when the center has had a discussion, have raised a few red flags. For instance, Chhattisgarh has said that there are connectivity issues in tribal regions of Sukma. So they're saying that they need a wireless sort of satellite sort of a internet connectivity there. They have also raised the issue of how certain centers, they might need air ambulance if there is an adverse reaction reported from these centers. They have cited that during the elections, that air ambulances are provided to Chhattisgarh and they should be provided even for the vaccination drive.
Similarly, Conan points out that Jammu and Kashmir has said that because of just 2G data available in the region, there is a big lag in entering data onto the Coven IT platform, and that it has asked if an offline platform can be provided to them. States like Telangana have said that they have experienced glitches in the Coven platform and are working to fix that with the help of the government.
So the larger issue is that since everything is centered around the Kaunain platform, which tracks not only beneficiaries but also tracks the vaccine stocks, also tracks the adverse event reporting, there'll be a huge pressure on the software. So even if we are assuming that a lot of states in the first few weeks, even if they cover 100 in one session, 100 doses, that will be a huge stress on the platform. So it'll be wait and watch. So if there is a delay, then the center has already told about the technical teams that will be working around the clock for each of the specific work that real-time data has to be uploaded. So that will be the biggest challenge.
The other challenge, Conan says, will be that because this is the first time that the adult population will be vaccinated, many of them with comorbidities, medical experts will have to be present to monitor any possible adverse reactions.
Because the existing adverse event reporting following immunization is focused only for children with pediatricians. That's the network. But for this immunization program, the network is enhanced. You need doctors from cardio, you need doctors from respiratory infection, you need internal medicine guys. So that will be a big challenge. And the challenge of even just reporting, making them sit for 30 minutes and monitoring them. So the vaccinators, who will be mostly nurses and ASHA workers, have to realize what kind of adverse reactions are happening, and they have to report that real time. So that is going to be a big challenge, because if we have a few adverse event reactions that are not being monitored, and then later that could lead to vaccine hesitancy among the general population. So that communication is very important. So the communication becomes important only if the data is uploaded on real time.
The challenge of scale, of transportation, of monitoring in real time across the country with experts present all along is considerable. But what is giving the government confidence is that the numbers of this initial phase is similar to that of the universal immunization program, plus the fact that there has been a lot of back end preparation.
Almost 25 virtual meetings have happened. You've had more than 20,000 vaccinators and those stakeholders who have been trained. So on that front, we are really good in terms of execution. But the only challenge is the fact that it's a new vaccine. You need to understand the universal immunization program, which is there. These vaccines are there for over decades. But this is a vaccine which has come on the basis of an emergency use authorization. It is going to be administered on the basis of very limited data from phase 1, phase 2, and phase 3 for one of the vaccines. It has not undergone a complete clinical trial. So you might have certain adverse event reports that could be reported from different centers. That is the big challenge. However, the administration itself, the logistics for the first round, in terms of the numbers, it is very similar to the universal immunization program. And the fact that what the government has tactically done is it has used the elections template.
The general elections is again a massive exercise that involves coordination and implementation right down to the block level. And India has been doing that successfully for years now.
What you've done is you've clubbed two very successful exercises. One is the elections in terms of identifying the beneficiaries and in terms of planning the sessions. Second is administration, which you are using the universal immunization program. But the big challenge for the government after the first two phases would be then to vaccinate the larger population, which is the 27 crore. That will be a bigger challenge. But then by that time, we would have more vaccine candidates coming into the market, more Indian vaccines as well as from abroad. And most likely, you will have a lot of private players then coming into the market. So you will have the hospitals, then you could actually go and get yourself vaccinated, but that would be somewhere in June, July on.
Now, as Conan mentioned, both the Oxford AstraZeneca and the Bharat Biotech vaccine have been approved for emergency use based on very limited data, and they have raised several concerns. This is especially true for Bharat Biotech's Covaxin, which was approved even though its efficacy data is still pending. And so, to understand these concerns and what exactly efficacy data is, we now speak to virologist Dr. Shahid Jameel.
Well, efficacy data tells us how effective the vaccine is going to be to either prevent infection or prevent disease, depending upon what the endpoint of efficacy is. For all COVID vaccines, the endpoint is prevention of disease. So, in a phase 3 trial, very large numbers of people are taken that are closest to the general population that you can come. Half of them are given the vaccine and half of them are given a blank or a placebo. And at the end of a defined period, which in this case is 2 months after the last dose of vaccine has been given, after 2 months, they are evaluated to see how many are showing symptoms of disease. And then the code is broken to find out of the people who show disease, how many belong to the vaccine group and how many belong to the placebo group. Based on that, you calculate the efficacy.
He explains that let's say after the end of the trial, you find that 100 people got the disease. You would then need to find out how many out of those 100 were given the vaccine and how many got the placebo. If 10 out of 100 got the actual vaccine, then the efficacy of the vaccine to prevent the disease would be 90%.
That's what efficacy is. It essentially shows how effective the vaccine is going to be to prevent disease in this case. So, not having efficacy data means that you're essentially vaccinating people blindly without knowing how effective that vaccine is going to be.
This is what has been done with the Bharat Biotech vaccine. And the concern, mind you, is only about the efficacy and not the safety.
Because safety has been tested at multiple levels. Safety has been tested in phase 1, safety has been tested in phase 2, and even in phase 3, you already know about safety because people have received the shots and they have not shown any serious adverse effects. So it's not a question of safety. It's essentially that you're flying blind without knowing how effective a given vaccine is going to be.
This decision has also raised questions about India's drug regulator that approved the Bharat Biotech vaccine. Dr. Jameel says that to be fair, the regulator does have the right to approve a vaccine without the efficacy data if it thinks the situation demands it. But in this case, the Drugs Controller General of India, or DCGI, had previously said that it would not approve vaccines with efficacy below 70%.
And then they have sort of overturned their own guidelines by approving a vaccine of unproven efficacy. So that's point number one. The second point, which I think is a more important point, is the kind of communication that happened with the approval. And that left many people confused as to what was going on.
He says that regarding the approval, there were 4 points made by the regulator. The first one was that it was being done in the public interest.
Now, of course, it is being done in public interest. Every vaccine is done in public interest. Covishield was also given in public interest. So, completely unnecessary to say that it's being done in public interest. The second point made by the regulator was that it will be in clinical trial mode. And that confused many people without any clarification because, when you do a clinical trial, you divide people into placebo and vaccine groups, whereas here you were going to give vaccine to everyone. So it was not made clear. The second thing that happens in a trial is that every trial participant receives an insurance cover. So it was not clear whether everyone who will receive this vaccine henceforth would also be covered by insurance.
The third point that was made was that the Bharat Biotech vaccine will also work against the newly emergent UK variant, which is supposed to be more transmissible.
Now, this is without any evidence. It is simply a belief. There's no evidence that this vaccine will work on a mutant, whereas other vaccines will not work on the mutants. So it's completely without evidence. And the fourth point made by the regulator was that, although I must say the regulator didn't say this, but I think it was said by Professor Guleria while defending this decision, that the regulator has approved this as a backup vaccine. There's nothing called a backup vaccine. A vaccine is a vaccine. You can't say that, I will go with the good vaccine, but if I run out of the good vaccine, I'll then give a backup vaccine.
The backup point that he talks about here is the one that government officials are still claiming. Many say that the Bharat Biotech vaccine may be used when enough doses of the Oxford vaccine aren't available.
So that paints a completely wrong picture. You don't approve vaccines to give as backup. By saying that, you're immediately saying that this is a second rate vaccine, which is unfortunate. It's not. I also believe that in the end, when all the data is in, Bharat Biotech vaccine will turn out to be a good vaccine. But that's my belief based on what I know from other vaccines. It is not based on data and evidence. So, those of us who have been talking about this are simply saying, don't go with what I believe or what you believe, simply produce the data. That's all. I'm not saying that Bharat Biotech is a bad vaccine. In fact, I honestly believe that it will turn out to be a good vaccine. But this kind of approval, has done, I believe, disservice to this vaccine itself.
The one thing to note is that the efficacy data that we have for other vaccines is only interim and not enough. But still, he says that you should know how effective your vaccine is to begin with.
So, a question that I would pose is, let's say after the efficacy data comes out, you figure out that this vaccine is only 30% efficacious. So, what will you do to the people who have received this vaccine? Are you going to vaccinate them with another vaccine? What will you do? So, these are the issues that prop up when you go with a vaccine with unknown efficacy.
By doing this, he says, you increase the chances of vaccine hesitancy, confusion, and make people think, why do they need to take a vaccine when we are not sure whether it is effective or not? And it's not just this. Dr. Jameel also points out another kind of damage that has been done to the vaccines.
Unfortunately, the biggest damage has been done by the heads of the two companies. They went after each other and trashing each other's vaccine in full public view on national television.
The head of the two companies had basically engaged in a war of words of sort. It started when the CEO of the Serum Institute of India, Adar Poonawalla, appeared on NDTV earlier this month. In the interview, he said this.
The main point here is that there are only 3 vaccines in the world who have proven efficacy, and which you need to do in 20 to 25,000 people. And even there are other Indian companies doing that at the moment currently, and we'll wait to see their result and score. But it's Pfizer, Moderna, and AstraZeneca, Oxford. These are the only 3 vaccines which have proven to work. Everything else has proven to be safe, just like water is safe. But the efficacy, to know how well a vaccine works, 70%, 90%, 80%, has only been proven in these 3 vaccines.
This was taken to imply that other Indian vaccines are basically just water. After this interview, Dr. Krishna Ella, the chief managing director of Bharat Biotech, gave a media briefing where he said that Oxford in their trials has tried to suppress adverse effects by giving people paracetamol.
You look at Oxford AstraZeneca, they have given 4 grams of paracetamol for every subject were vaccinated. That means they are suppressing the adverse reaction by giving a paracetamol, whereas we have not given a paracetamol to the volunteer. So whatever the adverse reaction that is captured in the clinical trial is exactly 100%, even if it is good or bad, it's captured in 100% real time. Whereas this one, 4 grams of paracetamol is given to suppress adverse reaction.
So the questions that are being raised about this vaccine or that vaccine are based on science, and they should always be raised. But the kinds of things that these two gentlemen have said to each other, one is calling the other's vaccine as nothing but water. The other saying that, they give paracetamol, so they don't see adverse effects. That reduces confidence in vaccines. And, they are both very good companies. They have done great service to the National Immunization Program. And it's a shame that it has come to this, simply because the regulator wanted to approve one vaccine without any data. It should not have come to this.
Just to be clear, paracetamol was given to people in the Oxford trials after they got the vaccine. And Dr. Jameel says that they shouldn't have done that, but also adds that it may not have been done to suppress adverse effects.
See, any vaccine, when it's given, If it causes a little stiffness in the arm, if it causes a little fever, that's actually not an adverse effect. That's something called reactogenicity. And reactogenicity simply indicates that the vaccine is working, is doing something in your body. So that's really not an adverse effect. Adverse effect is if somebody has breathing trouble, somebody has, like some people with the Pfizer vaccine or something, had facial paralysis. Those are adverse events. These minor events, continue to happen. I mean, last year I took the pneumococcal vaccine,
That's a vaccine against bacterial pneumonia.
which is a well-established approved vaccine, and I had a stiff arm. I had slight fever for half a day, and then I took paracetamol. It went away. So you take paracetamol when you get the reactogenicity. I wouldn't even call it adverse effect. But you don't give paracetamol to everyone to suppress it. And if they were doing that, they shouldn't have done that.
If we were to compare the way the two vaccines have been made, there are things that are new to both of them. That's why efficacy data for them becomes important. Dr. Jameel talks about the Bharat Biotech vaccine first, which is a whole virus inactivated vaccine, a kind of vaccine which is old and time tested.
Many vaccines currently in use are based on this platform. Bharat Biotech itself has a very good track record of making inactivated whole virus vaccines. And two examples I can give you is their flu vaccine and their rotavirus vaccine. So they have a lot of experience with this platform. But there is one element in this vaccine which is still untested, and that is an adjuvant that they are adding.
Adjuvant basically means an immunological agent that improves the immune response of a vaccine.
This is a new adjuvant that they acquired from a US company, and they are using that in this vaccine, which has never been used in humans. So, even from that point of view, I think it's important to establish full safety and full efficacy in a phase 3 trial.
So while the platform that the Bharat Biotech vaccine uses is time tested, the platform used by Oxford is fairly new, Dr. Jameel says.
It's based on an adenovirus, and adenovirus is a virus that causes common cold. In this case, it is a common cold virus from the chimpanzee, which has been used as a vector to deliver the spike gene and to make a vaccine against COVID. So it's a new platform, hasn't really been used earlier.
We asked Dr. Jameel, based on what he knows about the two vaccines, which one would he pick to inoculate himself if he had to pick one at this point? And he says that he's actually wary about picking either of them. Because while there is no efficacy data for the Bharat Biotech vaccine, like we have made clear before, he says that he isn't confident about the efficacy data of the Oxford vaccine either.
Simply because the Indian data for Serum vaccine is not out yet. The approval was given based on efficacy data that came from UK and Brazil. In UK, they used a half dose, full dose combination. In Brazil, they used two full dose combinations. In Brazil, the efficacy was 62%. In UK, the efficacy was 90%. So, which do I believe? And it is wrong to combine those two trials and say, okay, now my efficacy is 70.4%. It doesn't work like that. So, as far as I'm concerned, efficacy data on both vaccines is shady right now.
Though he once again emphasizes that as far as safety is concerned, one shouldn't worry too much about adverse effects. This is because safety is tested in the early stages of trials. He also says that the prices set for these vaccines right now are also fair and reasonable, especially compared to other vaccines internationally. And even if these vaccines were to eventually be made available in a public private arrangement in the open market, he says that that should be fine.
The only problem is if people who need a vaccine but can't afford a vaccine, if they are unable to get it. If somebody who makes 300 rupees a day has to buy a vaccine at 1,000 rupees, and is unable to get it through the government program, that would be a shame. So I think the government should focus on that when the eventual rollout happens.
Right now, what worries him about the vaccine drive is, like we discussed earlier, just the scale of it.
In the universal immunization program, India vaccinates roughly 26 million kids every year. And we are going to be vaccinating 30 million healthcare and frontline workers in 3 months. So the sheer logistics, I think, is something to look at. But I must say that I'm quite impressed with the plan that was put out, and especially the dry runs that have taken place, because they will not solve all our problems, but they will, at least point out what the weak links are, so we can address those. There will be hiccups when the plan is rolled out, but I think the intent is very clear to roll it out effectively, efficiently, and if there are any hiccups, to deal with them in real time. So I think it'll be all right. It's a challenge, but it'll be all right.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargav, and as always was edited and mixed by our producer, Joshua Thomas. If you like this show, then you can subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcast@indianexpress.com.